and gentlemen, welcome to another episode of Monitor Your Health by Dr. Femi Ogunremi. It's a program where we educate the public about health-related issues. Today, I have with me Dr. Ademola-Popoola, who will be taking us through certain conditions about our eyes. We know that in children these days, there are a lot of things that we miss, which ordinarily, if we're prompt enough, we will save a child's eye and then possibly their lives. So I don't want to go into it in details. We will be hearing quite a lot about this today. Well, I welcome Dr. Popoola. You're welcome, ma. Hello? 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 Wow. Hello, ma.
Hello.
I think we might have...
Yes.
Okay. You're very much welcome. Welcome, ma. Can you introduce yourself to the audience, ma?
Thank you very much, Dr. Femi Ogunremi. We appreciate your program. You are doing your best to improve the lots of our people. I appreciate the invitation to monitor your health, and in particular to monitor your health with regards to child eye health. I'm Dupe, like you said, Ademola-Popoola. I work as an ophthalmologist at the University of Ilorin and University of Ilorin Teaching Hospital. Thank you for having me. Good evening.
You're very welcome, man. So now, we've talked a lot, behind the scene about, an eye condition, which is quite interesting. It's something that if we pick early, a child can salvage their vision. So can you tell us about this white thing that we see in a child's eye that can cause a lot of issues if we leave it, a bit late?
Thank you so very much. If you don't mind, please allow me to share my slides so that the audience will also be able to see what I've talked to you so much about. They said, okay. So let's see if that will be possible. Thank you.
Welcome. So I will grant you access to share I think you should be able to do now. Okay. Okay, you can try now.
All right. Thank you. Yeah, I'm almost there. Where it's down. Are you seeing my slide now?
Yes, we can see your slide.
Thank you. So I think, let me put it on slideshow. Before we go to the specific about that whitish thing, I would like us to know that it's a great deal that you have done for us by bringing us up here. In the past few days, we've seen a lot. Even this morning, in my clinic, that white thing. And I want you to take special note of this hotline that we have set up as a country, as a people, so that when you see that white thing, you can call, and then we will direct you to the closest hospital where you can get the best of care in the country as of today. And that number is 0703 9000 464. So, and why is this important? It's important before we talk about that white thing, because it's a problem of childhood. I know we're talking about child eye health today. If you look at the population of Nigeria, children 0 to 14 years constitute about 43%. That's a huge resource for any nation. Some countries of the world, they are looking for how they will get children, more children into their population. We are blessed with this number, and they are the crop of people who have some of the problems we're going to be discussing today. And so if as a people, we pay more attention to them, we are investing in the future of our country. Now, why is this important? It's important because we know that vision drives development of children. About 83%, that's 8 out of 10 things that you need for learning comes through vision. And vision in itself helps other senses to work better. So when we have problems, that means it's going to affect many other things. In addition, we found some staggering information years ago when we tried to do some study. We found out that 7 out of 10 blind beggars, they've been blind from childhood. You are knowing them as adults, but they actually have been blind from childhood. And 8 out of these 10 beggars have never had an eye exam. 9 out of 10 children who are blind don't go to school. As at 2020, we just completed a survey of children in schools for children with special needs in Nigeria. We have about 4,000 children across Nigeria who are in those special needs schools as a result of being severely visually impaired or being blind. And we know that prevention of childhood blindness is an economic issue. We will talk about some of this. And the reason why that whitish thing is important is that a child is not a small adult. They don't know, they won't even complain. So you got to look out for it and help them out when you find it by presenting early. Unfortunately, it has got not much to do with education and status of the parents. Some very well-educated parents, they've done some unimaginable things. Even when they notice an eye problem, they would rather go round and round and round rather than go to the hospital. They will be pursuing all sorts of things, you know, and then when they come, we are challenged with what to do. The most recently conducted survey showed this across Nigeria for children who are blind. You can find your own geopolitical zone there. These are children who are in school, but we know that they are just the 10% of the children who are blind. 90% of them don't ever get to school. You can see that in every geopolitical zone, they are there. Though we have them more in the southwest and the northwest of the country. So what are the things causing this problem? The white one is one of it. Why? Because over time, causes of blindness in children have changed. In the past, it used to do with, had to do with vitamin A deficiency, measles, but with immunization, thanks to our public health and the massive immunization campaign in the country, that has changed gradually. And so we're increasingly finding the not so considered important issues of the past as the problems today. Problems of childhood cataract, cancer in the eye of a child, which is one of the ones we are so bothered about, especially in this month that is dedicated to childhood cancer awareness, and the need to wear glasses, of course, as well as some others. These children, because they are children, they don't complain. So you got to know what the problem may be. And so when you see a child closing one or both eyes, frequently bumping into things, not able to follow command, is delayed. When it's time to sit, it's not sitting. Time to walk, it's not walking. Time to speak, it's not speaking. Because these things are driven by vision. It's not because the muscle has problem, but the child is not seeing, so he's not encouraged to go and pick the next thing. So he sits here, or he tries to pick something, he bumps into something, so he learns to sit. So you will be wondering why your child is delayed. You need to check the vision. Or the little older ones, they don't want to play. When they want to watch TV, they are going right into the television. It doesn't matter who the parents may be, educated or illiterate. Some have very poor handwriting because they just write anyhow because they don't see. They don't do well in school. They keep rubbing the eye or blinking, or the eyes may turn in or out, dancing, or may be abnormal in size or color. So because they don't complain, that's why you need to help them. So the first of those white things is what we call cataracts. It's not only in adults that we have cataracts. Children are sometimes born with cataracts. It may be in one or both eyes. And it may start small and progress. And once it progresses and it blocks ability of light to enter the eye, that child becomes blind from it. We have seen cases in which people go to some malam, they put a needle in the eye to try to remove the cataracts. We had 2 cases like that last year. And of course, what will happen is initially, because you have dropped that white from the pupil, the eye will look like it improves. Because that thing you dropped ought not to be in the place it has dropped to. So it causes redness and invariably they lose the eye. That's the first one. But the one that steals not only sight, but also life is what we call retinoblastoma. It's the commonest eye cancer of childhood that we can see even from the day some children are born. Displayed here are various ways it shows itself and how it goes from one point to another. You can see the first picture towards upper left of my screen was just a three-week-old child. We have children who are born today. Somebody dares to look and then they find it. And for this child, it was in both eyes. It can just present itself as a squint. You can see it in the middle upper picture. One eye is turning in while the other is looking out. You may not even know there is a cancer there. Or this one, as it continues to progress, it becomes more obvious. It becomes white. At this stage, it's already an advanced disease. By the time it comes like this upper right picture, it's already a bit late to save that eye. That's why when we notice the glow or that squint is the first time to quickly present. If we don't do anything about it at this point, it can go in the different ways shown in the lower picture. Sometimes it consumes the eye completely and the eye shrinks with the cancer in place. So it's like you leave fire on your head, on your roof, and you go and sleep. In some children, instead of shrinking like that, because shrinking is the unusual way it will go from this upper right. It will keep pushing out completely. It will fill the bone of surrounding the eyeball. It will push the eyeball out. It will go to the brain. And of course, at that particular point in time, we have lost the battle. That child is not likely to live anywhere in the world. You can see the child on the lowermost right. The child was in pain because somebody neglected the disease so much that it became this painful. And if you leave it, it goes to every part of the body, the head, everywhere. I just want to show you what we see normally because we are eye people. We use a lot of cameras, images that you don't see. That's why you don't sometimes understand the issues because the camera that will bring this out is millions of naira. By the way, the upper left picture is what it should look like normally. You can see everywhere is looking nice. The blood vessels are going. This one looks like the moon is the nerve, the optic nerve that carries vision to the brain because the eye is actually an extension of the brain. The eye spreads itself throughout the brain from this nerve that we're looking at. When the cancer starts, you can see it starting small. That's the whitish glow you are seeing on top of that optic nerve. At this point, it's very manageable. That child will probably just have a glow sometimes that will be disappearing. The mother will notice or the father in the dark, or when they take a picture, it will disappear because it's not everywhere. It's only when this whitish thing is right aligned with vision that you will notice it. So when it's coming and going and disappearing, that's the earliest time you will probably notice and start to come. Later, it may look like the squints. Let's remember that not all squints are caused by this. Squint is just one way it expresses itself. There are so many other things that causes squint. It's not always a cancer. We should remember that. And if you leave it, you don't do something about it, it becomes like the lower left. You can see that it has taken over about half of that eye. And as you leave it, it takes over the whole eye. It spreads itself outside the eye. And then it looks like the pictures we showed here, this lower picture. So imagine that small thing keeps spreading because something has not been done about it. Again, this is showing the same set of children to let you know that if we do something quickly and early, there is hope. Because it's a disease that is so sensitive to drugs. When you use the correct medication, including treatment like cryotherapy or laser, the child can survive it. The child can even see. The child can live, can see, can preserve the eye. But when the child will come late, even though we may give the drug just to make the child look better or to give the child some life, you know, towards the end of life, that child will not likely make it. Like the upper left picture, unfortunately, that child did not make it. Even though the drug helped significantly. Look at that eye before treatment. When we started treatment, look at the way it appeared after just 2 months of treatment. So it's very effective. Now imagine if we had seen the child earlier, what would have been able to achieve. But these 2 lower children, they are still alive today. We have managed them for 13 years now, the 2 of them. We started managing them about 13 years ago, and they were about 3-year-old. They are alive, they are well. And of course, with our treatment and everything, you can see that you almost cannot know that there was a problem with their right eyes following treatment. Thank you very much. I think I should stop there before going to another cause of white eye. Thank you, Dr. Ogunremi.
This is quite interesting. You got me in there, so I'm almost entering into your story, actually. Many, you know, pictures, and I know that our viewers at home will be, you know, they will appreciate this because there are a lot of children out there. And, you know, the story you told me just before we came on, it was quite, and I think the people should hear because it's important what we're doing, getting this message across to people. Mia's sharing the flyer yesterday because we thought it's important because this week is the week for cancer awareness in children. I thought it'd be good for us to bring, you know, Dr. Popoola here. And then we shared the flyer. And today in our clinic, she saw somebody brought their children to the clinic, which is quite interesting because they saw this on the Facebook. So the purpose is for us to actually get this message out to parents, relatives, so that you know what you're looking for when you have your children. You know, we pray that God will protect our children for us, but at the same time, there's the minimum that is expected of us, you know, doing the basic things, like you see something abnormal, know where to go. Dr. Popoola, I mean, you said something earlier on about the treatment. Maybe we're going to still come back to the treatment. You talk about cryotherapy and laser treatment.
Yes.
Are those available locally?
Yes, they are available. Retinoblastoma is a cancer that is sensitive to treatment, but expensive to treat, but not impossible. I've told you about children who have survived it for many years now since we started to look at them. The average cost of treatment may be about 50,000, 40, 50,000 every month in the typical government hospital because they will mostly be managed at a government hospital. It's very demanding. Several people would come together to manage these children. And on the average, let me put perspective. In Canada, with a population less than about 40 million, going by what we checked, they see only 25 cases in a year. In UK, they see between 40 and 45 cases. And if you see the investment of this country in this disease, you would think all their life is about this disease. In Nigeria, in my own clinic alone last year, we had over 30 children On the average, coming for the first time, we're not talking about the one we were managing before. That's more than what the whole country in Canada sees. And the same thing is happening in some other big hospitals. That's my own clinic and University of Ilorin Teaching Hospital. At some other big hospitals in the country, across this country, we also see similar numbers. Now, because it's expensive to manage, some of the things we need are expensive. The chemotherapy, government has helped us. Even as recently as this past few weeks, they've worked with some people to make the drug cheaper. The drug that used to be about 18,000 before for one vial is now 12,000. And we are grateful for that. We know some people still can't afford this. So this treatment with drug is possible in a number of our hospitals, the big teaching hospitals in Nigeria. The laser is not available everywhere. The laser is available in some hospitals, in very few hospitals actually. The cryotherapy is available in also very few hospitals. But what we do, we have a network. If a patient presents to a center that does not have it, we talk amongst ourselves. We will say, okay, this is how I can go do it. When it comes to this level, send the child to this next place. And that is what we have done have helped us to manage to survival, to vision, to preserving the eye. Those children that have come, because children come with both eye disease. Imagine that with the cancer, and the cancer will be unrelenting. So it does not even matter which teaching hospital you present to in this country. The problem we have is that people come late. They go to like 6 other places before they get to that hospital where they can make the diagnosis. They will call it all sorts of things. They will even tell some of them, don't worry, it will go away, the child will outgrow it. All lies. Instead of just saying, I don't know what this is, send to the next person. So that's why we set up that hotline. If you call us from anywhere in this country, the person who holds that line will ask you, which state are you from? Where are you calling from? I'll be able to direct you to the correct hospital there so that they make a diagnosis, they determine how much they can do, and they decide on where is the next best place for this child to be managed. So we can be on top of it as a country. It's not impossible. Something, the laser is very expensive. When my hospital bought the laser about 9 years ago, it was $48,700 that laser was bought. So you can understand why it's not everywhere in the country. And we are very grateful. We have managed to keep the laser working since that time. But that was how much it was. The camera that took that picture that I showed goes for between $80,000 and $100,000. Yes, that's how expensive it is. So it's expensive, but it's not more than what we can do as a nation. Already, we thank God for the very few centers that have been able to do something.
Thank you so much. And this is so commendable. You know, I remember when we were talking about this 2 days ago, and you talk about this line and the lot of work that you do, you know, around it to even get it to this stage. And I think what you've done so far, which I think the public need to know and they need to actually tap into, is the fact that this collaborative efforts, this, you know, integrating everything so that resources that we have as a nation, we can actually utilize it effectively rather than somebody in Kano doing their own thing, somebody in Lagos, they're doing their own thing. And what they actually need to solve this patient might be in Ilorin. And we're here, we wait a very long time before the patient then gets to the center where they need to be managed. So that's actually commendable, man. And then one thing I think, this is just, I don't know whether this exists, you know, maybe there's any foundation or things like that that you have, especially with the costs of treatment that is involved in this. An average person, I don't think an average family can actually afford 30,000, 40,000 naira a month, or is it a month or so? You know,
every month, and that will go on for like initially for 6 months. If they come early, if they come late, it gets drawn out. It may continue for 1 year, and then the regular visits is really an expensive disease to manage.
Well, you know, abroad or in some of these developed countries, what they tend to do is to do, you know, there is a foundation that is supporting this thing. The money is there in the foundation. They can use for that purpose. I mean, I think that's the area that we need to be going in this country, because we know that people can't afford when it comes to, you know, out of pocket. And the people, majority of the people that will probably need this, there might be people who can actually, you know, afford it really. So if there's a foundation or there's a group that there's a kind of fund that is there, which they can tap to, you know, when it's necessary, that will probably go a long way. But how to put that together, that's not my area of specialization. But that's something I think it might be good for us to look into, you know, as a nation.
Yes, so, you are very correct. The truth is that it's taken us many years to come this far. I must tell you the truth. When I was training as for being an ophthalmologist years ago, we did not even use to this, the children come. When they come, they are like this upper left one. Now, because of all this that you are doing and other people have done, and we continue to do, we are now able to even save life, able to save eye, able to save vision. And gradually also we have come together, we are making appeals, we are, even though you may not be able to help us set up a foundation, what you are doing is one of it. I don't know, who knows who is listening to us? Who may call us at the end of this to say that we are ready to help these children. I remember years ago, there was a pharmaceutical company that gave us drugs for 1 year, free for every child who developed the disease at less than 1 year of age. The pharmaceutical company gave us the medication in my hospital. And I know that at some other hospital it has happened, like National Health Center, I remember that somebody also paid for some time to care for the children. So we need more and more and more of this. I can tell you that years ago, NTA in Kwara State, NTA in Lorin, Yabode Olorunishola, she went all out for this disease and helped us to save several of these children with advocacy meetings, philanthropies here and there, you know. So we've had help as we are continuing, and I pray that we'll continue to have more and more help, and it will get better organized going forward.
Well done, man. Well done. So now, I know that you mentioned that to manage this case or these cases, it's easier. Before, I know you have other things that you want to tell us about these white eyes, but obviously there are signs and symptoms that as a parent or even as a professional, doctors, things that they can pick early, that they can then say, okay, this patient needs to, I need to call this line now. You know, I'm going to call the line out again, but I need to call this line now and see how I can help this child. What are the things? So what are the core things that if I have a baby in my hand, I'm looking out for, apart from just, you know, the parent might not pick something, but when I'm looking at, I can take extra effort to look for in children to bring them forward.
Thank you so much, Dr. Ogunremi again. I've returned to this slide. The earliest presentation of this disease is a squint. That is right. The what we call awobadonbe, or the middle picture here. The child may turn in or out, and one can notice that at birth. I have also mentioned that some other things will cause this squint, but that is a pointer, it's a big, and it's an early pointer. In fact, the earliest pointer when the child is already born. By the way, this can be diagnosed when the child is still in the womb.
All right.
Yes, because for instance, this child, the one that came at 3 weeks of life, the disease actually was noticed the day the child was born by the parents. So it was already there before the child was born. So the ultrasound that is done, you know, usually they ask women to do many ultrasound. That ultrasound that is done from about the 8th month of pregnancy can actually detect this disease if it's already there. Because for some children, it doesn't come so early, but for those that have it as hereditary, it can be there at that point. So from that ultrasound, if the sonologist, the person who is doing the ultrasound, take careful look, he will notice this because the eye would have been formed and he'll be able to see and say, oh. And when we notice that we have that child be brought down, from about 34 weeks of life, because you are more likely to be able to save vision that way. But for a child that is already born, that whitish glow, you know, you look at the child, it looks like the eye is striking you. There's something whitish, especially in the dark. It's like, we call it cat eye, like Ojo Lobo, like the eye of a cat. You should know that you must get to the right place quickly, within 72 hours. You need to get to the correct place. That's not the time to go to chemists, to go to all sorts of places and be just try not to believe that there is problem. So when that happens, and in Kwara State where I work, we had established at some high volume immunization clinic, examination of children when they go for immunization. Now, this immunization staff they are typically nurses or community health workers. We just taught them how to simply notice what I have described. And from the clinic, they have referred 3 patients at 6 weeks of life. So that's another opportunity for children to be referred, because the parents will not know. They usually typically may not know. But if one is observant enough, you will know that there's something. The parents usually have probably at those first pregnancies, whose children, this child is their first pregnancy and they don't have elderly people around them. So they may miss it. But once it comes out as a glow once, don't wait. I had a patient, unfortunately, who at 4 months of life, she noticed the disease. But then because the people she went to see did not understand the problem, they kept telling her the child will outgrow it. This woman left from one geopolitical zone to another, before finally to our own. Not 3 geopolitical zones, she was looking for help all over the place. And of course, by which time the child was already 27 months. You can imagine. We had to lose one eye, but thankfully we were able to save one eye. So we want people to come early. When you notice it come, that's why that hotline is there. The hotline is there to like stop that many stops. You know, those places they go to that will cause delay. Elsewhere, it is unthinkable that somebody will notice any of this and you won't show up within 2 weeks at the correct place. In our own people, they keep this for years, and it's going to the head of the child, to the liver, to everywhere, you know. So that hotline, I think everywhere it should be in Nigeria. We will just help guide you. And if you're having problem at where we have referred you to, you can call back. We will speak directly to our colleagues there so that they can get help, because it's really something that must be managed quickly.
Thank you so much, ma'am. The other thing I would like to just touch on just before we round up, because we have about maybe 10 minutes more, is about other things that we can see, that might not be this, but in children, are very important for us to take attention, pay specific attention to.
Thank you very much. I've shown the picture of cataracts. It's very similar to retinoblastoma. We can always distinguish them, but then because there's a critical period in early life when that must be done, just imagine that somebody is blind from childhood and it manages to live for 70 years. That is 70 blind years for that person. Imagine what it would have taken from the family, from the individual, from the society. So that's the reason this is an important. It's not just blindness in adults, it's a big deal, but not like this one, because of the number of years and the resources involved. So the other issues that we are facing currently is blindness from being born premature. Now let me give us the figures again. In the world, India produces the largest number of babies born premature. Because also you think about their population, 1.2 billion. After India is China. After China is Nigeria. In Nigeria, we produce over 800 children born premature every year. And this has come from a number of things. Adolescent pregnancy, hypertension in pregnancy, multiple pregnancy. We know, we have a high incidence of twinning. Almost the highest in the world is in Nigeria. We have so many, and once those children are coming multiple, they will be small. They could come earlier. And then, of course, increasing in vitro fertilization now. And if you now transplant many babies from in vitro fertilization, the risk of them coming out too early is very high. Of course, there are some other issues around this. So when these children are born at about less than 8 months, at about 7 months, those ones that are born between 7 months and 8 months of life, they are the ones most at risk. And you'll be surprised that if you do not check their eyes and they develop what we call retinopathy of prematurity, they become blind within 4 months of life. This is not a cancer. It's just because the child is born premature. You can see that all the pictures I've shown today, they are not Oyibo pictures. They are Nigerian pictures. In fact, in our clinic, where we have been surprised in this recent past, almost every day that we go to screen, these children who are born premature in the neonatal incubator, whatever we call them, we have found one case in these past few weeks. So, but if you pick them, it's even easier to treat than retinoblastoma. Again, the same laser is useful for it. That's why that laser is a great investment for any institution. When you also have that laser, you can use it for diabetic eye disease. At least adults will be taken care of with that. A number of things, even for some form of glaucoma, it can be used for. So with laser treatment and some injections, that thing that would have caused blindness in this 4 months old would have been prevented altogether. But it's even worse than retinoblastoma in that nobody will see anything. By the time you are seeing what I'm showing on the screen, this whitish thing, that child is already blind and it's irreversible. So for this one, prevention is even much, much, much more. One, if we can prevent a child from being born premature, all the better. If they are then born premature, within the first month of life, that the eye of those children born between 7 months and 8 months must be examined. Please, if you ever have a child born like that, plead with the hospital to refer you or bring in an ophthalmologist that can examine the eye of the child and provide treatment. This one does not allow us any time. It's not like the one that you can say 6 months, we will refer. That treatment, when it comes to this, it must be done within a week.
Wow.
So that is another issue. I think I should just stop there for now.
Okay. Thank you so much, ma'am. I think this question is, I mean, this particular aspect is very important for, a lot of us in this country, to be honest, because majority of people go to private hospitals to give birth. And if this awareness is not there, when you go to private hospital, you have your baby, everybody is happy, and then they go home without, the screening, which is, I think, is very crucial in this case, in those high-risk patients, those one born prematurely, 7 months and things like that. Or maybe, it's really important for us to emphasize that for those of us that do not use maybe teaching hospitals or in places where we have, specialists like yourself, we should take extra effort to actually, look in the eye of children for things like this, or refer them appropriately to centers where is absolutely necessary. Thank you so much, man. So while we're rounding up, what would be your advice, or what would be your advice either to the government or individual generally?
Thank you so much, and we are grateful for this opportunity. My advice is that we all can do something. It's actually in our hands. Let me tell you that it is in our hands. Now, before I talk specifically about that advice, you mentioned something. We did a survey recently, and out of 15 children that we picked that became blind from being born premature, 5 of them were born at private hospitals. That's about 30%. So it's not a problem of a public hospital. It's a problem we all have. And so private hospitals will also do well if you are able to manage those children, tiny ones, please ensure that this is part of the care that you provide. Of course, it's also expensive to provide the care, you know, but what is the cost of vision? I'm sure we don't want to pay for it. Yeah. So what should we do? We all can do something. We don't have to be rich to do something. Some of these patients we've had, they've been detected by neighbors, by friends, by families, who would just say to the mother, oh, I think there's something wrong with your child's eye. Oh, please do something about it. That's something that person has done. We all should be aware to ensure that we help children to detect early. When a child is born, please, after the eye be examined. When you go for immunization, ask them. If you think that there's a problem with the eye of your child, don't keep quiet. Call the hotline 0703 9000 464. We will direct you. Everybody cannot come to Ilorin, but we have people who are specialists in other parts of the country that we can ask you to go to, instead of going shopping in all sorts of places where you will not be helped. In fact, many of them, before they get to the specialist, they spend all the money they have. So when they get to the correct place, there's no money again. Mm. Then when they come, I want to plead with all our hospitals to be helpful. Be helpful. Oh, don't send these children away. They don't have anywhere to go. Be helpful. Help them to be seen. We don't send any child away. They must be seen once they have come. At least let's rule out this blinding thing. Let's rule it out, you know. Then when they are not able to pay, we are pleading with philanthropies. You don't have to have plenty of money. Even if your money is just a little, you probably will be able to pay for one child. Some of the help we have received have come from outside of this country. You say that's helped us, they are still helping us. I told us that children with special needs, that we went to look at them. You said it was the one that funded that project. They are not Nigerians. They are just people who know about this problem, and they know that if we don't do something about it, it will invariably become their problem. So they do everything to help us. Why won't we help ourselves? You know? So let's help the children to pay. Let's help them to come. Let's help them to pay. Let's support the family. Sometimes some people come and just drop money. We have been fortunate to have plenty of that. I must say, they will say, oh, I have a birthday. Instead of spending all the money on bash, can you keep this for eye care of 10 children? We get this as far as Canada. People who live outside of this environment doing that for us. We need to do more of that. There should be legislation that will make it compulsory. In Kwara State, we have a legislation, but it must be funded. In other parts of the country, we don't even have a legislation. The Kwara State has what is called Child Side Protection Law that makes it mandatory for children's eye to be examined between birth and 5 years of life. But it needs to be backed up with action. We are doing the best we can do as individuals, and we need you to make it happen everywhere, including my dear states where we have. Thank you. So the number is also there on the screen. I hope you can see it. You can call that number and you'll be directed appropriately to the best place for the best care for whatever child eye problem the child may have.
Yeah, thank you so much, ma'am. So it's mean to have you here, you know, to enlighten us on this. And to the viewers, I want to, you know, sort of seize this opportunity again to encourage us to do what is necessary, what is needed to save the lives and the lives actually of our children. Because some of these things is not only about the life that we heard about the retinoblastoma, which is the first situation that was, the condition that was described. If we delay, it's not only about the eye again. It gets into the, you know, to the blood, gets to the brain, gets to everywhere in the body. And that means where it will cost life. It's a matter between life and death. And death. So yeah. we need to be prompt. The number to call if you have an issue is 0703 900 464. It's really important we keep this number. If as an individual you find somebody who you think might need this, all you need to do to help them is give them this number. Let them be aware. We need to be aware of our, of our health, and especially the health of our children as well. Thank you so much, ma. I just want to add to that area you talked about, what we can do as an individual. There are things that people, I know some of my friends and myself, we've done things in the past whereby you think on your birthday, people want to spend on you. They want to things. You might just divert that, to a laudable, a situation like this where you want to help in terms of need. Thank you so much. It's really a pleasure to have you, on the show today. We really appreciate you. We know that it's your time, and we know that you've put in efforts to make this happen today. Much appreciated, man.
Thank you so much,
Viewers,
Dr.
we welcome you again.
Nigerian children are grateful to you. Thank you. God bless you for all you do. And more grace.
Thank you.
Bye.
Thank you so much.
Yeah.
Bye-bye. So bye.
Bye.